Good evening, everyone. My name is Dinesh Kumar. I'm from Bangalore. Today, I would like to share few points about constipation. So, constipation occurs when bowel movement becomes less frequent and stools become difficult to pass. It happens most often due to changes in diet or routine or due to inadequate intake of fiber. So, what is constipation? So, if we want to define the condition, having fewer than three bowel movements a week is technically medically defined as constipation. However, how often you go varies from place to place, from person to person. Some people have bowel movements several times a day, while others have them only one or two times a week. Whatever your bowel movements are pattern, just it's unique to you and it could be normal. As long as you don't stray too far from that pattern, that should be fine. Okay. So there are some other key features that usually define, further. So it could be your stools could be dry and hard. Your bowel movement could be very painful, and stools difficult to pass. You might have a feeling that you have not fully emptied your bowel, right? I mean, like these are the other certain traits which will be considered as, constipation. So how does this constipation happen? Constipation happens because your colon absorbs too much of water from that waste that is passing through the intestine, which actually dries out the stool, making it hard in consistency and difficult to push it out of the body. So to back up a bit, if we have to understand the mechanism, right? When the food is normally moves through the digestive tract, all through the different phases of the movement, the nutrients are absorbed by the large and small intestine. During this course, the the colon part of the intestine absorbs a lot of water from the waste, and also the food is moving very slow, and the whole maximum amount of water is sucked out, and only the dry lump is left, which makes it more difficult for it to pass through, right? So that's the reason why usually the elders or the doctors suggest drink a lot of water, which keeps your bowel movement normal, or at least it makes smooth bowel movement, right? So then, can constipation cause internal damage or lead to other health problems? Let's look at that. There are few complications that could happen if you don't have soft regular bowel movement. So if someone is having a constipated bowel movement, then we should not live with it, because that would lead to some complications, which I will list now. Hemorrhoids. These are swollen, inflamed veins in your rectum area. Anal fissures, tears in your lining of anus, and hardened stool trying to pass through. Then something called diverticulitis, an infection in the uh, pouches that forms in the colon wall from that stool that remains and gets infected. Then there is something called fecal impaction, a pile up of too much of stool in the rectum, anus area. Then there could be a condition called where a pelvic floor muscle might get damaged due to a long time constipation, which may lead to a condition called urinary incontinence. Okay. So then what causes constipation? There are many causes of constipations. It could be lifestyle related, medications, or some medical conditions, or even due to pregnancies in ladies. So what are the common lifestyle causes? Eating food with low fiber, not drinking enough water, that's dehydration, not getting enough exercise, changes in your regular routine, such as frequent traveling or going to bed at different times, eating large amount of milk and dairy products, stress, resisting the urge to have a bowel movement. These are some kind of lifestyle conditions. Then there are some medications that causes constipation also. Let's see what are those. Painkillers, non-steroidal anti-inflammatory drugs, antidepressants, iron pills, allergic medications, anti-nauseatic, anticonvulsant, then some of the psychiatric medications. These also will trigger constipation. Some health conditions that causes constipation, like hypercalcemia, hypothyroidism, diabetes, colorectal cancer, your IBS, that's irritable bowel syndrome, and many others. So let's now look at what food to avoid to stay away from constipation. Alcohol. So frequent alcohol consumption, what will happen is it sucks out water. So whoever is taking alcohol, they will realize that in the morning they feel like their their inside is fully dried out and they want to drink water, because of this. So that will lead to constipation. So alcohol should be avoided. Gluten containing food. Gluten is a protein found in some wheat, barley, rye, triticale. So anything with gluten, whoever is having constipation condition should avoid. Processed grains, red meat, fried fast food, and of course I mentioned dairy products. So if someone is having constipation at a higher end, better avoid workout, because if you work out, your lot of water is lost, and somebody who has worked out would notice that their stool has become more solid. Somebody who's used to that workout regimen will have that experience. So either you top it with lot of water or avoid workout during that condition. So what food do we eat? Drink lot of fluids and increase the fiber content. Lemon juice with warm water. Figs, 5 to 8 figs soaked in water overnight or boiled in a glass of cow milk. Like Gulkand, it's a rose petal jam mixture. This will smoothen the stool. Sesame seeds used, in salads and cereals. Triple tea, um, wood apple fruit pulp, in juice form. And also traditionally, lot of ghee in your food or ghee in warm water will dilute that hardened stool and helps in the smooth movement of bowel. So these are the points which I wanted to cover. Thank you.